Welcome back to Great Dave's Medical Monday. If you have damaged, crooked, or discolored teeth, it can really affect your self-esteem. There are several ways to fix the appearance of your teeth, but one of the most effective is veneers. And here to tell us about the procedure, please welcome family and cosmetic dentist, Dr. Terri Alani. Also joining us is her patient, Veronica Cantu. Hi. All right, Terri, you see this all the time where people come in and they're like this because they feel so self-conscious about their teeth, and you're able to correct almost any problem there is.
No, it's incredible. That's one of the great things about being a dentist now is the positive effect that we can have on the patient, because you can't really put a price tag on improving self-confidence and self-esteem.
Right. And Veronica, what were the problems with your teeth and how did that impact you? And has it been since you were a child or in later years? Or
since I was a child. Ever since I remembered, I've had them like that.
And your teeth, some of the problems were what?
Discoloration, and they were like chipped and crooked, and I had some bonding, and the bonding had chipped, and it was discolored as well.
Yeah, so you just never smile.
No.
And Veronica, actually, she came in to see me as a result of being on this show.
Yes,
she saw me on the show, and she came in, and she's a beautiful girl.
Yeah.
And she's young. And when I saw her teeth, she said, "Could you please help me?" And of course. And as you can see from her pictures or before, she had some bonding. It was chipped. Her teeth were sort of short, discolored, and we put, I think it was 16 veneers, upper and lower.
And you said she had some bonding. And the thing is, Terri, is it so important for people to have it done by somebody who's a professional who gets how to do this?
Exactly, and over time, of course, the bonding does chip and stain, and I thought, you know what, we really want to give her the confidence she needs. She's gorgeous, and now she's got this beautiful smile, so I was very excited to do her case.
Yeah, break out that smile, right? Let's get a close-up, break out that smile. Are you used to it yet?
No.
Yeah, because I was noticing you hesitate before you smile because you're just such a habit that you had for so many years.
Yes.
All right, so beautiful smile, beautiful
Thank you.
girl, as you mentioned. Oh, let's talk about the process, because there's so many different things out there to address some of the teeth issues and even just bleaching and stuff like that.
There are, and one thing I did want to say about Veronica's is basically we did most of it without anesthesia. We did ultra-thin veneers, and I really want to give a shout-out to my lab, which is Alpha Dental Ceramics, because they do a great job, and they're in close proximity to my office, so the patient has the opportunity of actually being able to go to the lab, which is close, unlike having to ship some of your cases you know, out of state or whatever. So her veneers were made very thin, so we did not have to reduce hardly any tooth structure. And that was the beauty of doing that case. Now, not every case is like that, but we like to make them as thin as possible to conserve as much tooth structure.
Right, right, and that makes the process just less aggressive. All right, so veneers are made out of?
Veneers are made out, it's a thin porcelain shell, and they're very thin. And if you look at them, you'll think, oh, well, they will break. But when they are actually bonded onto the tooth, they are very strong.
Yeah, and then what about discoloring? Would you ever discolor
Veneers
them?
do not discolor. They just don't discolor, and that's the beauty of them.
Yeah, what veneers become are the perfect teeth.
Exactly.
Okay, so several things that you can correct there. Not only the discoloration that we saw and the chips that we saw there, but also when a tooth might be crooked. You know, yes, there's things like braces that you could use, but you can tweak with veneers where you don't have to go through that.
Exactly. If you have extensive crowding and whatever, you would want to go into like Invisalign, but for just teeth that might not be positioned quite correctly or slightly crooked, veneers are an excellent way of correcting that problem.
Now, Dr. Alani, in the olden days, you'd have to go in, they file down, you get some temporaries, and then go in again, and then go in again, and wait a couple of weeks, as you said, because they're shipped out from some other place. Now, because we have our labs here locally, and you choose to use the local labs where you can actually kind of have some oversight, this process doesn't have to take very long.
No, it basically was 2 weeks from the day we prepare them or slightly prepare them, then 2 weeks later, then the patient gets the case.
Okay, so you mentioned the types of veneers. There's a no prep veneer and then the prep veneer. On the no prep, what is that exactly?
The no prep veneer is basically what we did on Veronica, where you go in and just maybe slightly take off just a little bit of enamel on the front surface of the tooth. So we don't do a lot of drilling or what have you. The prep veneer really are for more cases where the patient has a little bit more crowding, maybe the teeth are more broken down, something like that, where you actually have to do some type of prepping to create the result that you want.
They can also be used to close in some gaps.
You can close gaps. Patients that have big gaps between their teeth or diastemas, it's an excellent way of closing that because they last.
Yeah.
And they're very, very lifelike. The new materials now are just incredible.
So you make the mold, And then that's what they base making those veneers off of. You choose your colors.
Exactly. The patient helps choose the color. We take photos. We send the photos to the lab, and then you have to have a great lab, and Alpha Dental Ceramics is awesome. And so that's the lab that I've chosen that does an incredible job on doing our veneers.
Now, how long will something like this last?
You know what? The first case I did was 25 years ago, and the patient still has them intact. As long as the patient, we'll actually advocate the patient wearing a night guard at night just to prevent anything from dislodging or what have you, but they can last for a very long time. But it's really important that the patient goes in for their bi-yearly recalls.
Yeah. All right, she's still not smiling, so I'm gonna have to. There you go. Tickle, 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 tickle. Now, there you go. Now she's smiling. All right. Dr. Alani has a special offer. We're all cozy here. Yes, Dr. Alani has a special offer through August. Get a free new patient exam when you schedule a regular cleaning with x-rays. To take advantage of this, call Dr. Alani's office at 713-621-5141, 713-621-5141, or find her on the web at texastoothlady.com. Also, Dr. Alani co-hosts a radio show with her brother, orthopedic surgeon Dr. Wayne Alani. It's called For Your Health with Terri and Wayne. It's on every Saturday at 9 a.m. on CNN 650 a.m., so be sure to check that out as well. One thing we didn't talk about, but next time, Snap-on Smile is kind of another way that you're able to instantly almost change somebody's smile.
Absolutely. A Snap-on Smile is a lot less expensive than veneers, but it's reversible, and it's a great option for patients that can't actually afford to have the extensive dentistry that Veronica had.
All right, there you go. Tickle, tickle. All right, up next, cramps, mood swings, hormonal imbalances. None of it's fun. Did you know that your horrible hormones could come from dear old mom? How to treat the symptoms the natural way when we come back.